So, tips for Americans moving to the UK. There are 5 prior episodes to this series. They are linked back from the link below on topics like firearms, basic costs of simple items, basic pain relief and rugs and things like that. Pew Pew ownership is also included in those links and explained. This is about emergency healthcare access. Now, a prior video covers generalised healthcare access. This is about emergency healthcare access. As I explained in the prior video, you can buy a package of healthcare from the UK government on entry to the country or before. It's about $2,000-ish and will give you pretty much unlimited access to the NHS with any hospital stay, even if you're here for 6 months on a visa, and it's every day of it costing just that amount with no top-up. You can also purchase private healthcare as any other person can, or any travelling citizen. You should really buy it when you're in the UK, although you do need to have it when you come here. You can get someone in the UK to purchase it for you from within the UK, which is a sneaky way around it. Generally, buying a healthcare package direct from an American supplier going through a broker will be far more costly. Now, in the UK, we have varying options for emergency healthcare. If you've paid for an NHS package payment, so you're not using private healthcare, or if you're here and you are, because emergency healthcare is accessible always through accident and emergency units, you would call 999 in the event of a healthcare emergency. And they'll send an ambulance or a paramedic to assess you. They will then ship you off to hospital and put you there for treatment. You can contact NHS 111. That will give you a phone line access to assessment for more basic problems. They will additionally send out a paramedic if needed, or refer you on to an out-of-hours doctor, or tell you to go and see a doctor during the day if they deem it non-urgent. Emergency dental care can also be accessed by dialing 111 and asking for dental services. They will assess you and decide if it's an emergency. You can then be seen on a weekend for around about £60 flat fee, and any additional charges may be on top if your healthcare access doesn't cover dental. Private dentistry cover can be used with NHS GPs additionally at the same location and with the same dentist, depending on what cover they accept. Check. For slightly less severe injuries that are during regular working hours, there are these things called walk-in centres. They're usually attached to hospitals. It implies what you would imagine. You walk in, you sit down, you get seen, you get sent off with a prescription or a referral to a hospital or to a GP, whatever's needed really, or whatever department. They will often tell your GP to refer you rather than them, but they will send forward information about you to your GP. You should register with both a private and NHS GP, so you have both options. You can do both. You don't have to pay for the NHS GP if you do the other, provided you bought your healthcare access package. You can walk into any pharmacy and get assessed for any very minor injury for completely nothing. If they decide it's more severe, again, they'll refer you on. They will suggest treatments, they will sell them to you.